Morning. It's a pleasure to be here and have this opportunity to present you some of our work that we've been doing along with an international team of experts surrounding a right-based approach to ECD. How can we enhance the state of ECD taking a rights-based approach? So in doing so, I'm going to be giving you a little bit of history about our work during the time that the Commissioner on Social Determinants of Health was happening in WHO. By the end of last century, we had seen a great deal of large volume of evidence that was pointing at a very unjust and gross health inequity across the world, but also within the nations. Evidence like this: out of 5 children born in Burundi, Pierre lives to be 1 year old, Liz lives to be 36, Jean up to 57, Anne up to 72, and Sarah up to 84. At the same point of time, 5 children born in Sweden. Pierre lives to be 63, Lisa 77, Jan 84, Anton 88, and Sarah 93. So that brings the life expectancy of people born in Sweden to 81 versus those born in Burundi to 50. And that's a huge difference, huge and unjust. So while everybody in Sweden gets to see 7 decades of life, that is a rare commodity in Burundi. Only 2 out of 5 see that. And while dying young in Sweden means dying in the 7th decade of life, dying young in Burundi means not seeing beyond first birthday. And we didn't need to see too far, to look too far to understand where is this coming from. This is just one explanation for this. On the y-axis, on the x-axis, we have income per capita. On the y-axis, life expectancy. So if we plot countries based on this criteria, Burundi with 50 years life expectancy falls at the lower spectrum, and Sweden at the high end of this chart. So it was awareness, this kind of evidence that brought to our awareness that what's happening is unjust. Health is not a fair and equitable commodity. Not only differs from nation to nation, but also within nations. A man born in one neighborhood of Glasgow can live 2-3 decades shorter than the one born in another end of the city, another neighborhood. So our attention was drawn to factors which were impacting our health above and beyond availability of health services, and we collectively named them as social determinants of health. To understand these factors better, so WHO in 2000s commissioned Sir Michael Mermet to identify important social determinants of health and designate centers who have the capacity, who have the expertise to research these social determinants and advise us, inform politicians, policymakers, and decision makers on how can we use these social determinants of health to make, as an entry point to enhance population health, but more importantly, so to make health more equitable. Our center at the University of British Columbia was designated as the Center for WHOKN Knowledge Network for Early Child Development, and along with 8 other centers who were researching other social determinants of health, we embarked on a mission. In 2 years, after 2 years of intense research, environmental scan, looking at the best practices across the world, we compiled a report and submitted to the commissioner, and commissioner put the reports coming different centers and published what we know today as commissioner's report, titled Closing the Gap in a Generation. Our chapter on it in this book is Chapter 5, Equity from the Start. How can we use ECD to make opportunities, health, employment, chances for marketability, labor force, everything, all the opportunities equitable and just for everybody? In this chapter, talking about ECD as one of the most potent social determinants of health, we introduce an ECD framework. We acknowledge that child development is a biosocial process. It depends on the biology, but also it is the result of experience of child within layers of environment that surrounds her or him. So if we want to drive this process to the best possible developmental outcome, we have to pay attention not just to this, but also all these environments around child, from the most proximal family environment to the most distal global environment. What happens to children, how children interact in these systems have a strong saying in their health and developmental outcome. While this was happening in WHO, there was something else happening in another end of UN agency, which was seemingly different and equally significant, but it took us for a while to connect the dots. The Committee on the Rights of the Child is the monitoring body of the Convention on the Rights of the Child. Convention on the Rights of the Child is an international treaty that was adopted by General Assembly in 1989, and soon after, every country, by now every country except 3 have ratified that. By virtue of this ratification, countries have the obligation to report to this committee every 5 years and talk about the progresses they have made in different areas of child rights, being education, being health, being right to social protection, right to participation, etc. The committee, in fact, articulates 54 articles as the rights of the children. And when we look deeper, it's not hard to see that these articles, in fact, are addressing those layers of environments that we talked about, the ECD framework that we submitted to WHO. I have put some of the examples of articles, but there are many more for every component of this framework. Article 6 talks about protection of right of child to health and development. Article 27 puts the obligation of supporting families who cannot support their young children on the government, puts this obligation on the government. Article 31 talks about child rights to play, leisure activity, and along with that, safety, security, availability of neighborhood playgrounds for a child. Article 30 talks about right to health, right to religion and religious group, and many more. All these layers of environment, and finally at the international level, Article 43 to 54 talk about governments having obligation to work with international agencies such as UNICEF to make sure all these rights are respected, protected, and fulfilled. By 2000s, when Commissioner was happening, the United Nations Committee on the Rights of the Child had come. By then, it was about 2 decades that committee had received these reports and had come to alarming observation that despite the fact that convention identifies child as any individual below age of 18, but most of the reports coming from countries were focusing on older cohorts and they were overlooking the younger to report about younger children. And that was alarming to the committee because the committee first of all, it was the assumption that this is just the tip of the iceberg. If the governments are overlooking reporting on young children, perhaps they are overlooking their obligation towards these young children altogether. Secondly, Convention sits on the premise of non-discrimination, and this was attacking right at the heart of Convention. It was discrimination based on age. So to rectify that, the committee took a day of discussion and created this resource document called General Comment 7, How to Implement Convention for Very Young Children. And when we say young, the UN definition is 0 to 8. So this document was introduced, and it didn't make very much difference in the nature of reports. So a group of us in 2006, 2007, we approached the committee and we proposed that this document made in all good intention but remains underutilized, and we need to operationalize that. We need to make it a tool, user-friendly and easy to use, and we just knew how to do that because this was an amazing group of brilliant minds that we put together to do this task. The group was, we acted as the secretariat of the group, the Arya Institute at the University of British Columbia, number of representatives from number of UN agencies, number of international NGOs, and donors. So we took on that task, and the result of the task was Early Childhood Rights Indicators, or what's known today as ECRI. It is the tool that allows us to monitor implementation of the Convention on the Rights of the Child, and in a very intersectoral way, in a very integrated way, covers all these domains that we think and we have been talking about. They are important if we want to make a difference in ECD, from education to health, to child protection, participation, nutrition, etc. So all the rights that govern, that come under the convention. The indicators are basically, the tool is basically comprised of 17 indicators. 17 indicators addressing 17 rights relevant to early years, from right to birth registrations, right to breastfeeding, right to play, right to leisure, right to educational provision, etc. All of the indicators have the same generic structure. I'm just going to show you a close-up of one example indicators. They are all comprised of three set category of questions. Questions about structure, asking about laws and policies that supports that right in a country, shows the commitment of governments. Process-oriented questions, asking about policies and initiatives coming out of these programs and initiatives coming out of these policies, and finally, outcome. How have we managed to change the lives of children as a result of these policies, these structures and processes in place? And then these are example questions when it comes to right to birth registration. For example, the policy questions ask, are there policies in place for universal, non-discriminatory, free of charge birth registration? A program question asks, are there programs to facilitate access to birth registration? And finally, has there been a decrease in the percentage of unregistered children? Anytime answer is yes, the respondent is supposed to provide supporting document. And then if the answer is no, then the software produces some suggestions, so the countries do not have to start from the scratch, and they can look and model the countries who have successfully done that. For example, if there is no program for increasing the access to birth registration, the software suggests provision of conditional cash, mobile birth registry, or facilitating late birth registration if a parent brings a child 5 years old to register, not penalizing parents. Every of these suggestions have a link attached to it, and the people can go and click and read more. For example, mobile birth registry of Mozambique, that will show how have other people done and give some key names and key information. When we presented these indicators to the committee recognized the significance of this to child right, but also to ECD, and then encouraged us to pilot this in few countries to see if this has to be modified based on the level of development of the country. We did a couple of pilots. We did a low-income pilot in Tanzania, and then we digitized the tool. We did Tanzania with hard copy, and then digitized and created a Spanish version of it, and then did a pilot in Chile. Collectively, both pilots showed us that this is an effective monitoring tool, not just for child right, but also for ECD. And this is one of the features that I'm particularly proud of, this feature of software. As you can see, these are color-coded response. These are indicators, structural questions, process, outcome. The yes answer is color-coded green, no, red, and then partial yes or no is yellow. After every response is filled, the software generates this. We call it heat map. This is an example of a middle-income country heat map. You can see there's under indicator 1 structure questions, 3 questions. 1 has been yellow, and then 2 other has been green. So you can see that this is a middle-income country with quite a bit capacity to support child rights. So it's not hard to see it's predominantly green. And now take a look at low-income country. But this is not the purpose of this practice, this tool. The purpose is to track every country's own progress. So it is a low-income country in 2012 based on real data. And it is our hope that this two next data I'm going to show is fictitious. It's not a real data. So it's our hope that moving from 2012, in 5 years, when this country is again due to report, we will see changes like this. So again, going from 2012, red, less red, more green, and green. So that way we can track the changes and capacities filled. So in a nutshell, Vaghri, as it is today, is the tool that facilitates taking an inventory of the existing capacities on ECD as well as child right. It shows us how many no's are there, how many yeses are there. It's a tool for advocacy. It facilitates using the identified no's and bringing the attention of the politicians and policymakers on those missing capacities. And then finally, for planning and capacity building, how can we turn those no's to yeses and enhance the state of children's rights, and as a result, enhance the children's development state. Carefully designed, validated monitoring tools like Vaghri can encourage participatory action of the society because it's intersectorally implemented, consensus-oriented. It has transparency, data speaks for itself. It's equity-based and inclusive because it sits on human rights treaties, and it's responsive because the governments are obligated to respond within the 5 years that next report is due. And then finally, accountability comes out of it, all of which are features of good governance. Good governance take care of their children, and they sit on human rights treaty and protect human rights. I'm going to skip that because I was shown that I have to stop. And this is just the cost of what is costing, what's inaction costing for us in BC based on what our economists have estimated. It's costing us 401.5 million if we don't correct the developmental gap we see in our children now. By 60 years, this is the amount we are paying. And this is just the amount in money. There are other ramifications of inaction. To say the least, societies who are not taking care of their children, they are often turbulent, and societies that are experiencing lots of political unrest because human rights promises peace and harmony in society. I'm leaving with a greatly articulated words of Mahatma Gandhi that says it in a best and effective way. Thank you.
Thank you, Ziba. Now, Constanza.